welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Home blood pressure reading more accurate than one taken at the clinic. According to a new study led by Kaiser Permanente investigators, blood pressure measurements routinely taken at home are more likely to provide the basis for accurate diagnosis of hypertension than those taken in a clinical setting. The findings come from a randomized controlled trial of 510 adults, the study being published in the Journal of General Internal Medicine. Current guidelines for diagnosing hypertension recommend that patients who have high blood pressure readings in the clinic have another test taken to confirm their results. While the guidelines recommend ambulatory blood pressure monitoring or home blood pressure monitoring before making a hypertension diagnosis, the research shows that providers must continue to use in-clinic measurement when conducting the second reading. Exercise to reduce the risk of Alzheimer's disease. Exercises are an easy key to good health. It should be mandatory as well as frequent and regular physical exercise is an important component in the prevention of various diseases such as heart diseases, cardiovascular diseases, type 2 diabetes and even obesity. Physical fitness has long been linked to a lower risk of Alzheimer's disease, but even moderate levels of cardiorespiratory fitness offers some protection. The study that I'm talking about will be presented in the American Academy of Neurology, wherein the findings do suggest that people can work towards making incremental changes and improvements in their physical fitness, which may help decrease their risk of dementia. The fact that you can reduce the risk of Alzheimer's disease by simply increasing activity levels is very promising, especially since there are no adequate treatments to prevent or stop the progression of the condition. Use of cusp-overlapping projection in TAVR reduces the rate of permanent pacemaker implantation. A novel cusp-overlapping projection technique was shown to significantly reduce the rate of permanent pacemaker implantation in self-expanding transcatheter heart valve implantation when this was compared versus the classical implantation technique. This was according to a recent study that was published in the journal JACC Cardiovascular Interventions, wherein it is the first study to systematically evaluate this particular approach for self-expanding transcatheter heart valve implantations in different populations. The authors of the study concluded that this technique did significantly reduce permanent pacemaker implantations in self-expanding transcatheter heart valve implantation cases compared with the classical implantation technique, however, which showed similar rates of complications. Pre-diabetic smokers likely to have high risk of albuminuria. Smoking is attributed to both micro and macrovascular complications at any stage of metabolic deregulation, including prediabetes, particularly those who develop the disease at a very young age. A recent study suggests that smokers with prediabetes condition are at a higher risk of albuminuria than those with diabetes. The study findings were published in the SSRN's preprints as a preprint with the Lancet, and wherein the authors did conclude that the smokers with prediabetes are at a higher risk of albuminuria than those with the ongoing diabetes condition. The risk in ex-smokers did not decline to a statistically significant level, presumably due to insufficient lag period since quitting. GLP-1 receptor agonists have better outcomes than DPP-4 inhibitors in type 2 diabetes patients and chronic kidney disease conditions. A recent study suggests that the use of GLP-1 receptor agonists was associated with better outcomes when it was compared with the use of DPP-4 inhibitors among patients with type 2 diabetes and advanced stage chronic kidney diseases. The study findings were published in the JAMA Network Open, wherein the authors concluded that treatment with GLP-1 receptor agonists was associated with lower all-cause mortality among patients with type 2 diabetes or even advanced stage chronic kidney disease, and this even included the end-stage kidney disease, and it was compared with treatment with DPP-4 inhibitors. That's all for today. I shall see you tomorrow.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.